Gamete freezing is basically the freezing of the egg or the sperm. As you all know, the chances of pregnancy would be dependent on age, and the first reason that we do gamete freezing is for fertility preservation. This is done in people who want to freeze their eggs or their sperm to use at a later date. The second reason that we do it is if a diagnosis of cancer has been done and if the person is planned for chemotherapy or radiotherapy, which can destroy the egg or the sperm, we freeze it and keep. And the third would be if any long-term conditions are there which can affect the fertility, we also plan egg or sperm freezing.